This is definitely one of the questions in the field of CAR-T, and for sure at the moment the access to these approaches is, for the majority of the approaches, is limited to few centers around the world, and this is surely one of the limitations of the approach that the community is trying to face, and it's deeply involved into improving the access to these therapies. Several improvements have already been performed in the field, such as improving the manufacturing procedures, so that now we have automatic procedures that can be repeated more easily in more centers, and this is already enlarging the number of centers that can use this approach. But surely we need to have a change in the models of use of this therapy, and so far the development of these approaches have been mainly in the hands of pharmaceutical companies, which are able to escalate the treatment up to the marketing phase, which is a great opportunity for more patients to access these therapies. But at the same time, we have some hurdles with this model, which are related to the fact that the cost of these products sometimes is very high, and that not all the unmet medical needs can be fulfilled with this model. So probably in the future, what the scientific community is thinking is to move to mixed models in which more philanthropic and public entities will be involved, so that the prices are reduced and that the academia can move forward products that have less common indications, but that still represents a high unmet medical need. So for sure the journey is still long, but we are moving in that direction, likely.